Mini heart attack symptoms. Mini heart attacks happen when there is a temporary blockage in the coronary artery. It can be extremely short lived compared to classic heart attacks, but is still serious. In fact, there are different kinds of heart attacks that people may not be aware of. What causes a heart attack? Heart attacks, also called myocardial infarction, happen when the flow of blood to the heart is blocked. These blockages are mostly a buildup of fat, cholesterol, and other substances that form plaque in the arteries. The plaque can sometimes rupture and form a clot that blocks the blood flow. When blood flow is interrupted, it can damage or destroy part of the heart muscle. What are 4 signs of an impending heart attack? Having a heart attack isn't always an intense feeling. Some people aren't even sure if what they are experiencing is actually a heart attack. That's why knowing the pre-heart attack signs is crucial so you can take immediate steps to get help. Chest pain. It may not just be pain. It can also be pressure, a squeezing sensation, or even feeling full there. This pain or discomfort is caused by an inefficient supply of oxygen-rich blood to your heart. It can last for a few minutes or may recur after a short break. Pain in other areas. Pain from a heart attack doesn't just happen in the chest. It can also happen in the arm, back, neck, jaw, or stomach. Not recognizing this pain as relating to the heart can prevent people from getting immediate medical help. Women tend to experience pain in other areas more so than men. Shortness of breath. Shortness of breath can happen with or without chest pain. It can also happen before or after a heart attack, especially for women. People can also experience nausea and lightheadedness. Cold sweats. Breaking out in a cold sweat can happen when you have a clogged artery. The body sweats to keep its temperature down during this extra effort. What are silent signs of a heart attack? Heart attacks that happen without a person knowing it are called a silent heart attack. People either don't have symptoms, minimal symptoms, or unrecognized symptoms. This does not mean they are not as severe. In fact, it often leaves scarring and damage to the heart that goes untreated because the person didn't know they had a heart attack. Silent heart attacks can be uncovered from an MRI or EKG that reveals a person had a heart attack weeks, months, or even years earlier. Women are more likely to have silent heart attacks than men, partly due to the fact that they may experience uncommon heart attack symptoms. It's important to get checked out if something doesn't feel right and know your risk factors. Signs of a silent heart attack are the same as a heart attack that is recognized right away. It's important to take note of anything that doesn't feel right and get help immediately. What does a mini heart attack feel like? In about 50% of all heart attacks, the person believes the symptoms they are experiencing is caused by some other less serious problem. This can increase a person's risk of dying from it. Mini heart attacks are temporary blockages in the coronary arteries and can be very short-lived and mild. Because of the lack of intensity and that people may feel normal before, during, and even after the incident, it often is unrecognized. Sometimes these are referred to as silent heart attacks because people don't recognize they are actually having a heart attack. Many heart attack symptoms mirror the same symptoms as a more recognized heart attack, including chest pain that may come and go, pain in the throat that may be confused with indigestion, fatigue, shortness of breath before or during the heart attack, discomfort in upper back, jaw, neck, or stomach, feeling lightheaded and/or nauseous, and having cold sweats. Any of these symptoms could be a sign of a heart attack, so it's important to seek medical assistance immediately. How long does a heart attack last? Heart attacks aren't necessarily a quick event that's over in a matter of minutes. With all of the symptoms that a person may experience during a heart attack, it can last for 30 minutes or more. Mild heart attack symptoms may only last for a few minutes and then stop with rest. But a full heart attack with complete blockages lasts much longer. Can heart attack symptoms go on for months? It is possible for people to notice the symptoms months before an actual heart attack occurs. Others might not experience anything before the heart attack happens. The typical heart attack symptoms may be experienced, such as chest pain, shortness of breath, and cold sweat. But remember, women are more likely to experience atypical symptoms as well, such as fatigue or back pain. It's important to know your risk factors for heart disease to assess early symptoms. This includes family history, blood pressure, cholesterol levels, and lifestyle. People can experience heart attack symptoms suddenly or gradually. Suddenly. In this situation, a person may not have any previous symptoms until a plaque deposit ruptures, triggering a sudden heart attack. Gradually. In this situation, coronary disease progresses and an artery gets narrower over time. Supplements for your heart. Whether or not you are at risk of a heart attack, leading a healthy lifestyle is important. This includes exercising, eating healthy foods, and taking appropriate vitamins, minerals, and supplements. Spermidine is a supplement that can increase longevity through cellular growth and regeneration. We are born with blood polyamines that assist us with cellular growth. As we get older, cellular growth and renewal decreases, as does our blood polyamine levels. This leads to many of the symptoms we associate with aging, such as certain diseases. Our bodies try to replenish these blood polyamine levels throughout our lives, but we rarely consume enough through diet alone to replenish it as fast as we age. This is why spermidine may help. It assists the body with its own autophagy process, allowing cells to rid themselves of old dysfunctional components, resulting in healthier cells. It is important to note that we cannot claim to cure or heal any illness. A healthy lifestyle with the right diet, exercise, medical care, and supplements may be able to help you live a long and healthy life.